When we heard about a ransomware attack this week on Truman Medical Center, we were relieved to learn that it didn't involve sensitive data or patient care.
But we were intrigued by how they resolved it. KCTV5's Betsy Webster has a closer look now at a growing insurance industry that's creating controversy in the IT world.
The demand came to Truman Medical Center via email. We've locked you out with ransomware. If you want the encryption key to get back in, you need to pony up.
It's a business model.
John Schramm is president of IT firm The Purple Guys. He says paying ransom should be a last resort.
Because you're really saying, hey, I paid the ransom this time, I'll pay it again. And I've got money to pay it. So you're putting a bigger target on yourself. You're also reinforcing the business model, that is to send out spam emails, try to get people to click on stuff.
But Truman Medical Center paid the ransom. Quote, a small amount of money for which the medical center was insured, their written statement said in part. That's right, there's an insurance policy for that. It's called a network extortion expense, part of a cyber liability policy that came onto the scene 10 years ago and really took off in the last 2 or 3, says Emily Short.
Policies that will pay a cyber extortion or ransomware demand are actually really common.
Short is VP of Technology Risk at insurance brokerage firm Brush Creek Partners.
2 years ago, I probably would have told you the average demand was $1,000. They are finding that people pay the demands, so they are asking for more.
She says the most common demands range from $500 to $20,000, but she's seen some for $1 million or more. One technique used to limit damage is segmenting the computer network into different parts so the hacker can only get a piece of it. That seems to be what happened here. The spokesperson for Truman Medical Center says the hacker did not get into patient data or financial data. The only example she would give is, well, we had to stop using automated controls on our thermostat and go to manual.
It sounds like they're following best practices, which means the critical data and the critical systems have extra layers of protection.
But even temperature controls are crucial in a hospital, which is why healthcare clients are prone to pay up.
You are dealing with patients' lives, you are dealing with things that are very time sensitive. You don't have time to transfer everything to a new system, upload it again, and get that information.
The city of Baltimore is one example of how expensive taking the high road can be. They were hacked 3 months ago. The New York Times says the Bitcoin demand was the equivalent of $75,000. The city's budget office estimated the cost of recovering at $18 million. But some experts say it's worth it in the long run to avoid repeat attacks, which is why 300 mayors joined Baltimore last month, vowing not to pay ransom to disincentivize cyber blackmail. Betsy Webster, KCTV5 News.
We asked Truman Medical Center for the dollar amount of the ransom demand and their insurance deductible for filing the claim, but they declined to share those specifics.